Every year, over 12 million people have a stroke. Most of them had no idea it was coming. But here is what the research actually shows. Your brain almost always sends warning signals before a major stroke happens. Sometimes hours before, sometimes days before. The problem is not that the signals are invisible. The problem is that most people over 60 do not recognize them for what they are. They attribute them to aging, to tiredness, to stress. And by the time the major event hits, the window for the most effective treatment has already closed. A stroke occurs when blood flow to part of the brain is cut off. Brain cells begin dying within minutes. But in the majority of cases, the event that causes the full stroke is preceded by a smaller event. A partial blockage, a brief disruption, a warning the brain is sending out before the system fails completely. Knowing these 5 signals does not just save quality of life, in many cases it saves life itself. Before we reach sign number 3, there is one warning signal on this list that accounts for more missed strokes in adults over 60 than all the others combined. Neurologists have a specific name for it. Most people who experience it assume they are simply tired or dehydrated. You will know exactly what it is before this video ends. Sign number 1, sudden weakness or numbness on one side of your body only. Not general fatigue, not the kind of heaviness you feel after a long day. This is weakness that appears without warning in one arm, one leg, or one side of the face. It affects one side only. That asymmetry is the key detail. The brain processes movement and sensation for the right side of the body on the left side of the brain, and vice versa. When a blockage or bleed disrupts blood flow to one region, the signals stop on one side while the other side functions normally. A study published in Stroke, the Journal of the American Heart Association, found that unilateral limb weakness was present in over 60% of stroke patients in the hours before their event. Many of those patients had noticed the weakness but attributed it to sleeping on their arm, overexertion, or muscle fatigue. The distinguishing feature is that you cannot explain it. You did not sleep on it, you did not work out that muscle. The weakness appeared on its own, and it may come and go. That coming and going is actually more alarming than if it stayed constant. A symptom that appears and then resolves is the brain telling you the blood flow was cut off briefly and then restored. That is called a transient ischemic attack, and transient ischemic attacks are among the strongest predictors of a major stroke within the next 48 hours. In fact, a large study published in the New England Journal of Medicine followed patients who had experienced transient ischemic attacks and found that 10% of them went on to have a full stroke within 2 days. Another 15% had a stroke within 90 days. That means that if you experience one-sided weakness that comes and goes, you are living in the highest risk window for stroke that exists in medicine. Therefore, sudden one-sided weakness that appears without a cause and resolves on its own is a medical emergency, not a reason to sit down and see if it gets better. Not a reason to call your doctor in the morning, a reason to call emergency services right now. Sign number 2. A severe headache that feels completely different from any headache you have had before. Stroke patients and neurologists use almost identical language to describe this. They call it the worst headache of my life. It comes on suddenly, often within seconds, reaching peak intensity almost immediately. It is not the dull ache of dehydration or the throb of a tension headache that builds over hours. It arrives at full force. This type of headache is the signature symptom of a hemorrhagic stroke, where a blood vessel in the brain ruptures rather than becoming blocked. The sudden pressure from bleeding inside the skull produces pain unlike anything most people have experienced before. Unlike a tension headache or a migraine, it does not respond to over-the-counter pain medication. It is also not made worse by light or noise the way a migraine typically is. It simply arrives at maximum intensity, without a clear trigger. A study published in the Canadian Medical Association Journal found that patients who described their headache as the worst of their life had a significantly higher rate of serious intracranial events compared to patients with other headache presentations. Among patients over 60, the threshold for what qualifies as the worst headache of their life is often set too high because many people in this age group have lived with chronic headaches for years. They compare the new headache to their worst migraine rather than recognizing that this is an entirely different category of pain. The quality of the pain is what matters, not just the intensity. Sudden onset, maximum severity within 60 seconds, location at the back of the head or behind the eyes. Pain that does not change with position or movement. These features together are a neurological emergency regardless of how the patient rates the pain on a scale. If someone near you describes a sudden severe headache as the worst they have ever felt, they need emergency services, not a dark room and aspirin. Sign number 3. Vision changes in one or both eyes that last more than a few seconds. This includes sudden blurring, double vision, loss of vision in one eye, or the appearance of a dark or gray curtain dropping across part of your visual field. Vision symptoms are one of the most commonly dismissed pre-stroke warnings because they are easily attributed to tired eyes, dry eyes, or the need for a new glasses prescription. The visual cortex sits at the back of the brain. The blood vessels supplying the eye and the blood vessels supplying the visual cortex share common origins in the carotid artery system. When a clot partially blocks that system, the eye and the visual cortex can both be affected before any other symptoms appear. The vision loss may last only seconds. It may affect the full field of vision or only a portion of it. It may occur in both eyes simultaneously or in one eye only. A transient loss of vision in one eye, sometimes described as a shade being pulled down over the eye, has a clinical name called amaurosis fugax. A study in the journal Neurology found that patients who experienced this symptom had a 15% risk of full stroke within the following 90 days without treatment. That is 15 times the baseline stroke rate of the general population. The vision returns. The patient assumes everything is fine. But the underlying cause, a partial blockage in the carotid artery, is still there and still active. The next event may not resolve. It is also important to note that double vision, where you see two of everything, is specifically associated with blockages in the posterior circulation of the brain, the vessels that supply the brain stem, and the cerebellum. Double vision combined with any other symptom on this list is a posterior circulation stroke warning and should be treated with the same urgency as any other combination of symptoms. Sign number 4. Sudden confusion, difficulty understanding what people are saying or being unable to find the right words. This is the warning sign that neurologists consider the most commonly missed in adults over 60. It is the one that gets dismissed as forgetfulness, as a senior moment, as stress, as not having slept enough. But the confusion associated with a pre-stroke event has a very different quality from ordinary forgetfulness. It comes on suddenly. You were fine a moment ago and then you cannot remember the word for something you use every day. Or someone is speaking to you and the words sound like they make sense individually but you cannot understand the sentence, or you try to speak and what comes out is not what you intended. The words you hear yourself saying are wrong and you know they are wrong but you cannot correct them. This happens because the left temporal lobe, which processes language in most people, is extremely sensitive to blood flow disruption. A partial blockage in the middle cerebral artery, one of the most common sites of stroke onset, can temporarily shut down language processing while leaving other functions intact. The person may look completely normal. They may be standing, walking, and responding, but what they say and what they understand is disconnected from what they intend. A report from the National Stroke Association found that sudden confusion and language difficulty was the most underreported pre-stroke symptom in adults over 60. Fewer than 30% of patients who experienced it called emergency services. Most waited to see if it passed. Many of them had a major stroke within 24 hours. This is the symptom neurologists call transient aphasia. The reason it gets missed is exactly because it is transient. It passes, the patient feels fine and slightly embarrassed. They may not even mention it to a family member, but the event that caused it is still active, the clot is still there, the artery is still narrowed, the next disruption may not be transient. Bystanders play a critical role here. If someone you are speaking with suddenly seems confused, cannot finish a sentence, uses wrong words, or seems to be struggling to understand you, and this is a change from their normal behavior, ask them to smile and raise both arms. If one side of the face droops or one arm drifts downward, the evidence of a neurological event is visible. Call emergency services immediately. Sign number 5. Sudden dizziness, loss of balance, or difficulty walking that appears without warning. Not the lightheadedness of standing up too fast. Not the occasional unsteadiness of stepping off a curb. This is a sudden loss of coordination that makes you reach for a wall, sit down unexpectedly, or feel like the room is moving. It may come with nausea. It may come with a sensation that the floor is tilting. It arrives without warning and may last only a few seconds or a few minutes. The cerebellum controls balance and coordination. It is supplied by the posterior circulation of the brain. Blockages in the vertebral and basilar arteries that feed this system produce sudden dramatic balance disruption. A study published in JAMA Neurology found that sudden onset dizziness combined with any other neurological symptom, even a mild one, increase the probability of a posterior circulation stroke by over 40% compared to dizziness alone. The critical distinction is sudden onset. Dizziness that builds gradually over minutes or hours is rarely a stroke warning. Dizziness that appears in an instant, without any positional trigger, and especially alongside any of the other 4 signs in this video, is a stroke warning until proven otherwise by a physician. It is also worth noting that posterior circulation strokes are the most frequently missed strokes in emergency medicine. Because the symptoms can include dizziness, nausea, and difficulty walking without the classic one-sided weakness, they are sometimes attributed to inner ear problems or vertigo. A study in the journal Academic Emergency Medicine found that posterior circulation strokes were misdiagnosed on initial presentation in over 35% of cases. Knowing that dizziness can be a stroke symptom, especially when it is sudden and accompanied by anything else unusual, is information that can directly change the outcome of that conversation in an emergency room. What to do if you notice any of these signs? The action is simple and the timing is everything. Call emergency services. Do not drive. Do not call a family member first and wait for them to arrive. Do not search for symptoms online. Time is brain. That phrase is used in neurology because it is literally true. Every minute of reduced blood flow to the brain destroys approximately 2 million neurons. The treatments available in the first hour of a stroke are dramatically more effective than those available 3 hours later. And some of them are only available within a specific time window that closes permanently once it passes. When you call emergency services, tell them you believe someone is having a stroke. Use that word. It activates a specific protocol in most emergency systems that fast-tracks imaging and specialist assessment. Do not describe the symptoms and wait for them to categorize it. Tell them it is a stroke. If you experience 2 or more of these 5 signs at the same time, that combination is a stroke warning regardless of how mild any individual symptom seems. You do not need chest pain. You do not need to collapse. You do not need to lose consciousness. Any 2 of these 5 signs occurring together is enough reason to call. Write these 5 signs down tonight. Put them somewhere your family members can see them. Because the most important thing about a pre-stroke warning is not whether you recognize it in yourself. It is whether the person next to you recognizes it in you when you cannot.